Hi, my name is Sunny Joyce. I'm one of the surgery nurse practitioners on the pediatric surgery team. You and your child have made it through the gallbladder operation, and now it is time to go home. The purpose of this video is to go over the instructions for caring for your child once you are at home. Don't worry, this video is not the only instruction that you will receive before leaving. We have written instructions that you can take home too, and a member of the staff will go over them with you. But in case you forgot what I say during this video, it will be written down for you. And if you want to view this video again, even after you get home, you will be able to find it on the All Children's Hospital website at www.allkids.org/surgery. First, let's go over care of the surgical wound. Sometimes your child's bandages will be removed while you are still in the hospital. But if they are still on when you leave, make certain you remove the dressing after 2 days. Taking off the dressing is not difficult. Just peel up the edges of the adhesive bandage gently to remove it. Underneath the bandage, there may be some steri strips. These look like little pieces of tape. Do not take these off. The steri strips remain on to give the incision extra strength and protection while it heals. Do not remove the steri strips when you take off the bandage. The steri strips will fall off on their own in about 2 weeks. Just treat them as if they were regular skin. They can get wet, and you don't need to put a new bandage on top of them. When you first take off the dressing, you may notice a little redness from where the bandage was stuck to the skin. This is normal. There might also be some puffiness or some black and blue around the incision. This can also happen sometimes. In addition, the steri strips might have some dried blood on them. That's okay too. What is not okay is if you see active bleeding, spreading redness around the incision, or pus draining from the wound. If this happens, make sure you call us. While the bandage is on, your child only can have a sponge bath. However, once the bandage comes off, your child can take a shower. You probably shouldn't soak the wound underwater, like in a bathtub or in a swimming pool, until it has healed for 1 week. Now, let's talk about pain. It is normal to have some pain after an operation. Your child was given medicine in the hospital to minimize this pain and may still need medicine after you go home. Let me review a couple of the common medicines we recommend, but remember, every child is different and some kids may have allergies or reactions to medicines. So, during the discharge process, we'll go over which medicines are okay for your child. Acetaminophen, commonly known as Tylenol, or ibuprofen, commonly known as Motrin, are both over-the-counter medicines that are very effective for treating pain after an operation. These are the most common pain medicines that we recommend. You should follow the dosing guidelines on the bottle. Sometimes these over-the-counter medicines are not enough, so you will also be sent home with a prescription for a pain medicine that can be filled at a pharmacy. Your child may need to take other medicines after you go home. For example, some patients may need to be on antibiotics, or you may have questions about when to resume any other medicines that your child takes regularly. We'll review this with you on a case-by-case basis. After a few days, much of the pain will go away, but that does not mean that your child is ready for full activity. The body is still recovering, so we recommend light activity only for 2 weeks after you go home. This means no gym, sports, or other strenuous activity. As far as going back to school, we think that parents know their kiddos best, and when you think they are ready, they probably are. Of course, they should not go back to school if they are still on prescription pain medicine. And we generally recommend that the child have a couple of days of feeling back to normal before they head back to the classroom. Most children are back in about a week. Many families ask to have a note for school. A copy of the written discharge instructions will often suffice, but we are very happy to provide a formal doctor's letter when you come for your follow-up visit. We like to wait to give you the note at that time, since we will know exactly how many days your child has missed. More on this at the end of this video. Once you are at home, there are several warning signs that you need to be aware of. Fever greater than 101 degrees Fahrenheit, nausea or vomiting that persists after 12 hours, bleeding, although some blood on the bandage is okay, pus from the wound, spreading redness around the wound, worsening pain, or jaundice, noticing the eyes turning yellow. If you have any questions about these warning signs, or if you have any other concerns, feel free to call us. We always have a pediatric surgery, nurse practitioner, or physician's assistant working 24 hours a day, 7 days a week. If they can't take your call right away, we'll call you back within the hour. There's also a pediatric surgeon on call all the time if it turns out to be something serious. Obviously, if you have a true medical emergency, you should dial 911. The last thing I'd like to cover is the follow-up visit. We generally like to see you back 2 to 4 weeks after you leave the hospital. There is no extra charge for this visit. The purpose is for us to check to make sure everything is okay and to share any late arriving test results with you. Also, we can provide you with a school note. Our offices are based here at All Children's in the Outpatient Care Center across the street from the hospital. We also hold office hours at some of the All Children's outreach centers. Once you get home, call our office and talk to our staff. They will help you schedule an appointment at a time and location that is most convenient for you. We're glad that you are ready to go home. This video was meant to give you some useful information. If you forget anything that I covered, you can watch this video again at home over the internet. Just go to our website. And we'll see you in a couple of weeks at your follow-up visit.